Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 27th of January. And I would honestly say this is one of mixed emotions because, as the Prime Minister announced yesterday, 100,000 deaths from COVID across the country. I'm looking at a figure for us in the Trust which shows that we've had 650 deaths within 28 days of a COVID diagnosis in our hospital since the beginning of the pandemic. So thoughts go out to all the families and friends of loved ones who've been affected in this way, and also to our staff who have borne such a brunt of this awful illness and disease, and of course it's still ongoing. We've had 29 further deaths in the last week. On the other hand, we see our inpatient numbers having come down a little bit, so that we've got 126 positive patients today. That's within 14 days of their first diagnosis, compared to 169 this time last week. That's a reduction of around 40, isn't it? And when we look at the community numbers for the Fylde Coast, whereas for Blackpool last week I reported 308 positives per 100,000, that figure is now showing at 271. Fylde seems pretty flat at 329 compared to 322 last week, and Wyre has come down a fair bit at 290 compared to 381 last week. But encouragingly, the number of people positive over the age of 60 looks like it's dropping quite quickly. So that is really important because, of course, age is an independent risk factor for serious illness, and that's where most of the hospital patient group comes from. So I'm cautiously optimistic about that data. The immunisation programme is going really well, and at the weekend we went over our 10,000th immunisation and continue to progress in hospital at a rate of something like 400 immunisations each day. And of course the Winter Gardens has opened up in Blackpool, and our GP colleagues through the primary care networks are also immunising at quite a rate. So we're seeing massive positive impact in terms of immunisation, and again need to just reiterate the message that please wait to be called by your GP surgery for immunisation. You would never be asked to pay to be immunised for COVID. This is all free at the point of need through the NHS, and we really are rattling through the numbers at a great rate now. So there's a cause for some optimism in that fact. Testing still widely available, so the message remains the same. If you feel you have any flu-like symptoms which could be indicative of COVID, then please put yourself forward to get tested, either through calling 119 or looking at the NHS 111 website. And our ED department remains really busy, and of course again we continue to segregate patients to minimise the risk of COVID transmission. So if you do have a medical condition that you're worried about which is urgent but not an emergency, then please could I ask that you contact NHS 111 or your GP surgery for advice before you make a decision to travel to EDs. We're continuing with our elective programme as much as we possibly can. Our pressure on intensive care beds, which I described last week, is still intense. So having moved from 16 beds to 32, we still need to staff those beds fully, and that means from time to time we've had to stand down some of our elective programme. And again, I apologise to anyone who's had any kind of cancellation of their services, but I promise you we're trying to keep that work going just as much as we can, and we'll pick that up again as soon as we have some proper capacity to do that. So finally, the public health messages stay exactly the same. We're in something like the fourth week of lockdown. It looks as if we're seeing some impact from that, plus the immunisation figures, but the messages around hand washing, around face coverings in public spaces, and 2 meters of distance remain so important to protect ourselves as individuals and our loved ones and the rest of our population. So thank you so much for all that you're doing. It looks like there's something good happening to the figures, and we have to keep with it. Thank you.